Hi everyone, this is Ted Bauman here, editor of the Bauman Letter. Earlier this year, I advised readers of the Bauman Letter to sell an exchange-traded fund that we held, which contained healthcare stocks. And I got a couple of people asking me why I was doing that. They said, look, the healthcare sector looks like it's actually not doing too badly. Why do you think things why should we sell now? And I said, well, I think once you see the political season start, once we start seeing a lot of action from the Democratic candidates for president in 2020, people are going to start talking about healthcare and they're going to panic. And that's precisely what's happened. Last week, United Healthcare, one of the biggest insurers in the country, released a statement from its CEO basically saying that Medicare for all would be a disaster for the country because it would essentially wipe out the business model that his company is based on. That's not why he said it, but essentially that's what he meant. Now, I'm not going to talk here about the likelihood that we will see Medicare for all. That's a political question. But the question is it going, if something like that were to happen, would it be universally bad for all healthcare stocks? And the answer to that is absolutely not. I think what a lot of people fail to understand is that the healthcare system that we have right now is in many ways designed to benefit one set of healthcare stocks, the insurance sector, at everybody else's expense. And a Medicare for all program would actually shift the benefits somewhere else. It wouldn't eliminate all of them. So let's review briefly what was likely to happen if we did have a Medicare for all program in the United States. Well, first of all, as United Healthcare's CEO observed, it would be disastrous for the insurance companies. Companies like Aetna and United and Cigna would see disastrous falls in their share prices, because essentially they would lose access to the mass market that was given to them courtesy of Obamacare. A lot of people forget that although the Republican Party was very much against Obamacare, it was actually a huge benefit to the insurance sector because it forced people to buy insurance policies. There were lots of drawbacks. It wasn't good for people who already had insurance policies necessarily, but it was good for the insurance company's bottom line. So, a Medicare for all program in which the government would essentially provide Medicare-like benefits to everybody in the country would destroy those companies' business models and ruin their share prices. The only thing they'd be left to do is probably provide top-up boutique healthcare policies for rich people who could afford them. The second set of losers would be those hospital groups that are currently relying on monopoly pricing and the ability to fiddle prices and conceal pricing because of the complexities of the private healthcare insurance system. A lot of hospitals around the country have become increasingly dominated by chains that own all the hospitals in a particular geographic region, which allows them to charge excessive pricing because there's no competition. Medicare for all would eliminate that and would essentially bring everybody onto the same bandwidth, the same pricing program. I suspect that any sensible Medicare for all program would involve regional pricing models based on the cost of delivery of services, which is many times higher in rural areas. But nevertheless, it would prevent companies from charging things like $1,000 for a $60 pill, which is what I have seen in some of my research on Medicare, or rather medical pricing abuse. Pharmaceutical companies might also see losses because right now they're not allowed, or the U.S. government, Medicare, is not allowed to negotiate with pharmaceutical companies to bring their prices down. Imagine that. Your Congress has approved and has never repealed a law that prevents our government using our taxpayer money to negotiate with drug prices or with drug manufacturers to lower their prices. That's crazy. Well, under Medicare for all program, that would surely go away. And so a lot of the excessive expenditure that goes towards pharmaceutical companies would also disappear. But there will be winners. And I think some of the winners are going to include the companies that have started to build up chains of local urgent care clinics, local ambulatory surgical clinics, and other small medical services centers that are less than hospitals. They're basically localized because they've learned how to specialize in cutting costs. They've learned how to develop a business model that can actually compete without gouging people like the big hospitals do. Another beneficiary would probably be home healthcare service providers. because I would imagine that a government-based healthcare program would actually encourage people to be treated at home out of a hospital setting, also to save costs, because it's been shown that it does do that, in fact. The third beneficiary could, in fact, be pharma companies that are producing drugs that treat lifestyle-related diseases like diabetes and heart attacks and strokes. One of the biggest problems that any healthcare system faces is the fact that because we don't have good primary care in this country, people only see a doctor when they've actually had a major health problem like a heart attack, or when they actually come down with diabetes. If Medicare for All was really trying to cut costs and save money, it would probably use medications that help to reduce the incidence of these diseases, even if people continue bad dietary habits. So there are three potential winners. You have basically looking for healthcare stocks in companies that are providing networked small unit, small facility care, home healthcare providers, and pharma companies that are helping to combat lifestyle diseases. So I think it's not all bad news. As I said, I'm not predicting what's going to happen if there was a Medicare for All proposal, but I would encourage you to remember that the current system is not a market-based system. It's one that was designed really with the lobbying of the insurance industry, and it's designed to benefit them. So be careful when they cry crocodile tears about Medicare for All. It's because they're afraid of losing the excessive profits that they earn thanks to that. This is Ted Bauman signing off. I'll see you again soon. Bye-bye.